In this video, we'll study about the fetal period. The fetal period extends from the beginning of the third month up to the termination of pregnancy. This period shows maturation of the tissues and the organ and rapid growth of fetus with less tissue differentiation. It is associated with the complete development of the placenta, umbilical cord and the fetal membranes. During the third lunar month, the fetal head forms about half of the CR length or crown rump length. The face assumes a human form with the eyes placed ventrally. The upper extremity exceeds the length of the lower one and the external genitalia become apparent so that the sex differentiation is possible to ascertain. The intestinal loop in the physiological umbilical hernia is withdrawn into the abdominal cavity. So these are seen in the third lunar month. In the fifth and the sixth month, the head assumes about 1/3 of the CR length, that is crown rump length, and the fetus grow more rapidly in length than in weight. At the end of the first half of pregnancy, the fetus acquires half of the full term length, although its weight during this period is about 1/6 of the birth weight. The skin becomes wrinkled because of the lack of the deposition of subcutaneous fat. The fetal movements may be experienced by the mother during the fifth month, and this phenomenon is known as quickening. Fine lanugo hair, eyebrows, scalp hair are visible during this period. So these are the changes which is seen in the fifth and the sixth month. In the second half of the pregnancy, the fetus gains more in weight and assumes a rounder contour due to the deposition of subcutaneous fat. Its weight at birth is about 3000 gram and its standing height, that is crown heel length, is about 50 centimeter. The fetal head is reduced to 1/4 of the CR length, although the circumference of the head is still the largest of the entire body. Now, the lower extremity exceeds in its length than the upper extremity. The skin is covered by a sticky and slippery substance that is known as the vernix caseosa, which is formed by the admixture of the secretion of sebaceous gland and the exfoliated cells of the epidermis. At the end of the seventh month, the alveolar outgrowth appear within the lung buds and are surrounded by blood capillaries. If the pregnancy is terminated after the seventh month, the fetus may have an independent existence due to the establishment of pulmonary respiration. Hence, the seventh month is called the viable age of the fetus. A full-term fetus presents at birth completely descended testes in the scrotum in male, attachment of the umbilical cord in the center of the anterior abdominal wall, and the appearance of an ossific center at the lower end of the femur. Next we'll see the stages or the horizons of the development. The entire process of the human gestation is broadly subdivided into germinal period for the first 3 weeks, embryonic period from the 4th to 8th week, and the fetal period from the 3rd to 10th lunar month till the birth of the neonates. For further detailed study of sequence of development, the germinal and the embryonic period are classified into number of stages or horizons. The stages 1 to 9 cover the first 3 weeks of the germinal period, and the stages 10 to 23 show the changes in the embryonic period, and the fetal period is recorded by noting the monthly changes from 3rd to 10th lunar month. Stage 1 is fertilization. Stage 2 is cleavage division from 2 blastomeres to 12 cells. Stage 3 is the formation of blastocyst from the morula. Stage 4 is the disappearance of zona pellucida and the implantation of the blastocyst in the endometrium by adhesion and penetration. Stage 5 is the completion of implantation, differentiation of syncytial trophoblast and cytotrophoblast, appearance of amniotic cavity and exocoelomic membrane, and syncytial lacunae are filled with maternal blood. In stage 6, you can see the chorionic villus system and their side branches are well defined. The primitive streak appears and differentiation of the embryonic area has started. In the stage 7, notochordal process and the intra-embryonic mesoderm develop from the primitive streak, and the chorionic stem villi are more prominent at the embryonic pole. Appearance of blood cell islands in the wall of the definitive yolk sac, and appearance of the cloacal membrane, allantoenteric diverticulum, and the primordial germ cell. In the stage 8, development of the precaudal plate, primitive pit, neural groove, the notochordal and the neurenteric canals. In the stage 9, the neural groove deepens. The developing brain shows the formation of cephalic flexure, optic vesicles, the commencement of the head and the tail folds, and the first somite begin to appear. Stages 10 to 12, which is the 4th week. Here you can see the somite formation continues, the neural groove closes and the 3 brain vesicles appear. The lens vesicles, aortic placodes and the branchial arches appear. Head and the tail folds are completed. The cloacal membrane and the hindgut are definable. The heart tube fuses to form a bulboventricular loop. Rudimentary limb buds appear, and rudiments of thyroid gland, lungs, liver, pancreas and mesonephric tubules are identifiable. Next we'll see the stages 13 to 16, that is 5th week. Here the alar and the basal laminae of the neural tube are differentiated. Cranial and the spinal nerves with their ganglia are developing. Formation of corpus striatum and the thalamus become apparent. The limb buds display joint flexure and differentiation of the hands and the feet are noted. Appearance of olfactory placodes, maxillary and frontonasal processes, rudiments of tongue, Rathke's pouch and tubotympanic recesses are noticeable. Primordia of thymus and parathyroid gland appear. The septum primum and the foramen primum appear in the developing heart. The mesonephric duct reach the cloaca and give rise to ureteric buds from their caudal end for the development of metanephric kidneys. Gonadal ridges, urorectal septum and genital tubercles are definable. Next we'll see about the stages 17 to 20, that is about 6th week. Here the cerebral hemispheres, pontine flexure and the rudiments of cerebellum appear. The facial region differentiate rapidly and the palatal and the primitive nasal processes appear. The bucco-nasal membrane ruptures. The midgut loop herniates into the umbilical coelom, wherein the appendix and the cecum are differentiated. The spleen develops in the dorsal mesogastrium. The Mullerian ducts differentiate by the side of the mesonephric duct. The foramen primum of the heart is closed. Septation of the bulbus cordis appears and the cardiac muscles differentiate. Chondrification starts in the skeletal elements and ossification of the clavicle and the mandible appear in membrane. Next we'll see the stages 21 to 23, that is the 7th and the 8th week. The embryonic period ends with the completion of these stages. This is manifested by pattern differentiation which leads to organogenesis. Thereafter appears the fetal period extending from the 3rd to the 10th lunar month. During the fetal period, the growth is more predominant than differentiation. During the 7th and the 8th week, the following features are observed. The face appears a human form with the completion of upper lip and the nostrils. Enamel of the teeth develops from the ectodermal dental lamina. External ears and eyelids are developing, but palate formation is still incomplete. Hands and feet are well defined with the separation of the digits. Interventricular septum of the heart is completely developed. Skeletal and the smooth muscle differentiate. Cartilaginous ossification appears in most of the bone. Metanephric kidney start functioning after the establishment of communication between the secreting and the collecting tubules. Testes or ovary are developed. In female, the caudal part of the Mullerian ducts are fused to form the rudiments of uterus and vagina. The external genitalia shows sexual differentiation. During the 3rd month, eyelids are united temporarily until the 6th lunar month. Nails appear on the digits. Physiological umbilical hernia is reduced due to the increase of the abdominal volume. During the 4th month, the lanugo hair, that is primary hair, appear over the body surface. Eyes move further forward and medially. External ears shift position from the upper part of the neck to the side of the head. During the 5th month, the sebaceous gland become active. The secretion of the sebum mixed with the desquamated epidermal cells form a cheesy covering of skin known as vernix caseosa, which prevents the maceration of the skin by the amniotic fluid. The mother experiences fetal movement which is known as quickening. During the 6th month, the skin is wrinkled due to the lack of deposition of subcutaneous fat. The eyelids are kept open and the eyebrows are well developed. During the 7th month, growth of hair over the scalp, eyebrows and eyelashes are seen. The pupillary membrane disappears. The body assumes a rounded contour due to the deposition of subcutaneous fat. The fetal lungs get maturity due to the development of rudimentary alveoli in a meshwork of pulmonary capillaries and appearance of surfactant fluid from the type 2 pneumocytes. Hence, the 7th month is called the viable age of the fetus. During the 8th to 10th month, there is progressive loss of lanugo hair except the hairs of the scalp, eyebrows and eyelids. Growth in the length of the lower limb is almost similar to that of the upper limb at the time of the birth. The thoracic cage increases in circumference and infra-umbilic part of the abdominal wall shows a relative increase of surface area. The full-term fetus at the 10th lunar month presents the umbilicus at the center of the abdominal wall, the testis in the scrotum, and the appearance of epiphyseal center at the lower end of the femur.